Knee pain affects about 25% of adults. And if you've been struggling with knee pain for a while, you've probably tried all the stretches and all the exercises and may still continue to find yourself struggling, which leaves you really frustrated because you don't know what to do for your knee pain, as well as why this knee pain continues to happen. I'm Dr. Amy Konvalin, specialist physical therapist, and I get asked this question all the time in the clinic. Why has my knee pain not gone away, or why does it keep coming back? And the truth of the matter is that it may not be your knee that's actually the problem. It may be coming from above in your hip, your SI joint, or your low back, or it may be coming from your foot. Now, I'm not saying that you don't feel the pain in your knee. I understand that you do feel the pain in your knee. What I'm saying is that it may be a problem somewhere else that's actually causing you to feel that pain in your knee. The knee joint overall is a pretty basic hinge joint, which means it has one plane of motion. You can extend it or straighten it. You can flex it or bend it. So you've got muscles and tendons and ligaments and cartilage, and all of these can have abnormal stresses that are being put on them, which can be pain generating or lead you to get pain signals and make you feel like your knee is painful. However, my question for everybody who walks into this clinic is, why did that tissue get painful in the first place? When people start to have knee pain, often they'll put some ice on it, take some over-the-counter medication, and maybe rest for a couple of days to see if their knee pain will go away. When that doesn't work, they go to the doctor who prescribes some pain medication, maybe some more rest, or maybe even some physical therapy. The doctor may or may not do an x-ray at that initial visit. People will go to physical therapy and be given exercises to do, which may help a little bit, but may actually increase their pain, which sends the people back to the doctor. And at this point, if it's their second visit and they haven't had an x-ray already, they're probably going to get an x-ray of their knee. But nobody is looking at the root cause of this knee pain or why those tissues in the knee got aggravated in the first place. You see, the knee is a basic hinge joint, but it is directly affected by the hip and the foot, and indirectly affected by the SI joint and the lumbar spine, or low back. So how can the hip affect knee pain? Well, decreased strength in the hip can cause the knee to move abnormally while you're doing activities such as walking, running, or squatting, which can then put abnormal stress on the tissues in the knee. If you have decreased motion through the hip, this can cause knee pain because the knee pain has to try to adjust or compensate for the lack of mobility in the hip. And you may have altered your walking pattern in order to compensate for either pain in your hip, decreased strength in your hip, or decreased motion in your hip. And all of this puts abnormal force through the knee. Let's move down to the foot. The foot is a super complex structure. It has 26 different bones that all need to be working correctly together. It is responsible for transmitting the force from the ground up through the body, as well as being able to adapt to different ground conditions. So if you're walking on asphalt versus rocky path versus grass, your foot needs to be able to adjust to all of those different motions. Now, the foot will transmit that force up through the tibia and the fibula. So the tibia is the big shin bone, the fibula is the little shin bone, and those two create part of the knee joint. And so if you're having any struggles in your foot and you're having abnormal force going up through the tibia and the fibula, obviously that's going to directly affect the knee because those are the bones that help make up the knee joint. So if you've been struggling with knee pain for too long, you may have tried going to the doctor. You may have tried the pain medication. You may have tried the resting. You may have even tried PT, and you've been wondering why your knee pain is not getting better. Hopefully you're understanding more about your body and the fact that your knee pain may actually be caused by a dysfunction that's going on above in the hip or below in the foot. And not addressing this root cause may be the thing that has caused you to deal with knee pain for longer than you should. Now, if you're looking for something that you can do to relieve your knee pain right away, I definitely love to do some self-massage to help decrease the tension in the knee joint, which will help to decrease the pain. I understand that it's only going to be a temporary relief. It doesn't necessarily address the root cause, but sometimes temporary relief can lead you to moving more normally, which can help that joint to actually heal. So if you'd like to learn how to do some knee self-massage, check out this video over here, and I'll see you soon.